Many people aren't aware that you can be denied when applying for a Medigap plan based on your health history. In this video, I'm going to explain why this may happen and what to do if it happens to you. Medicare Supplement plans, also called Medigap plans, are a form of supplemental insurance that are specifically designed to work in tandem with Medicare. They do this by covering most of what you would be left with in out-of-pocket costs if you were to only have Medicare by itself. They're very popular because these plans have no networks, no pre-authorizations, and aside from a monthly premium payment, people on Medigap plans often see little to no out-of-pocket costs when they use their health coverage. You may be interested in switching to a Medicare Supplement plan because your current premium has gone up, or because your coverage isn't as comprehensive as you'd like it to be. There may even be some of you out there that are already on a Medigap plan who are simply looking to change companies to help lower your premium. Regardless of your reasoning, if you've already been on Medicare Part B for 6 months, you'll likely have to go through medical underwriting before being approved for a plan. This is where insurance companies can ask you a series of health-related questions to approve or deny your coverage. We'll talk more about the types of health questions you can expect to see a little later on in this video. Now, there are a couple of exceptions to the 6-month rule. If you live in one of these states, then medical underwriting doesn't apply. Or if you experience a qualifying life event, then you may have guaranteed issue rights for certain Medigap plans. If you aren't on Part B of Medicare yet, or are within the 6 months of your Part B effective date, then you're still able to sign up for a supplement plan in what's called the Medigap Open Enrollment window. This is a one-time 6-month period that's triggered by the effective date of your Medicare Part B coverage. During this period, you can enroll in any Medigap plan you'd like with any company without having to go through underwriting. That's why choosing the right plan with the right company during this period is so critical. We have a lot of great videos on choosing supplement plans that I recommend you watch if you're in this situation, and I'll put these videos in the description below. Alternatively, you can give us a call for free advice in choosing a supplement plan at any time. If you're no longer in your Medigap open enrollment window and one of these exceptions doesn't apply to you, there's no way around it. You must go through underwriting in order to qualify for enrollment in a Medigap plan. Now, you may be wondering what types of health conditions may cause you to be denied coverage. And unfortunately, there's not a comprehensive list that tells you which conditions could disqualify you from enrollment. On top of that, each supplement company's underwriting criteria is different from one another and may even change from year to year. This is why working with an independent Medicare broker, like us, who's knowledgeable about each company's underwriting criteria can be so critical in saving you both time and money. That being said, you're unlikely to pass most companies' underwriting if you've recently been diagnosed with cancer, have diabetes with certain types of complications, have had a heart attack or stroke within the last few years, or if you have an upcoming test, treatment, or surgery that has not yet been performed. Again, each of these companies' criteria for passing underwriting is a bit different, and some are less strict than others. Some companies may deny individuals who've been diagnosed with cancer within the last 2 years, while others may extend that window to 5 years. Some companies may look at the medications that you're on and use that as disqualifying criteria, and others may even use your height and weight, while some don't factor that in at all. So, what can you do if you've been denied coverage, or if you simply know that you wouldn't get through underwriting due to your health history? As I've said before, the first and simplest solution here is to make sure you pick a solid plan with a reputable company when you first go on Part B. Again, for most people, this is the one time that you have to enroll in a Medigap plan and be guaranteed that you'll be accepted no matter the company or your health. A lot of people that call us up with this issue tell us they wish they had known they weren't guaranteed a plan, or that they'd done more research before choosing the plan or company they went with. So if you're still in that process, please be sure to talk with an expert that can help guide you through picking the best Medicare plan for you. Now, if you've been denied coverage with one company, that doesn't necessarily mean that all companies out there will reject your application. It can be common for one individual to be rejected by one company because they take a certain medication, while another company would accept them. This, again, is a time when I would strongly recommend you give us a call so we can talk through your situation and can let you know if there are other companies that may accept you. For those individuals who are already on a Medigap plan and are looking to switch either companies or plan types, there are some states that have either a birthday rule or anniversary rule where you can switch Medigap plans without going through underwriting. You can see which states have a birthday rule here. But remember that you must already be on a Medicare Supplement plan in order to take advantage of this rule. Lastly, if you simply can't get through underwriting and don't live in one of those birthday rule states, a final alternative is to switch to a Medicare Advantage plan. Although Advantage plans typically have more restrictions and often higher out-of-pocket costs to you, they could be a good alternative for some people that are looking to help cap their medical expenses. Because these plans have much greater variability in what they cover versus what you are responsible for paying, it's really essential to talk through your options with someone who can help you understand the pros and cons of these plans. In summary, if you've been denied coverage or are simply worried about getting approved for a Medicare Supplement plan, there are options available to you. At Seniors on Medicare, we help people in these types of situations on a regular basis, and our service is always free to you. We're licensed nationally and work with a variety of insurance companies, so our only loyalty is to helping you find the best plan at the best price for what you need. I hope this video was helpful, and it would truly mean a lot if you liked this video and subscribe to our channel for regular Medicare tips and information. Otherwise, cheers and have a great rest of your day.